Hello, everyone. So today we're going to tackle bone cancer. I'm Audrey Kalina, a BSN 3 student from Visayas State University. So what is bone cancer? We're going to start our topic by talking about bone tumors. So bone tumors can affect any bone in the body and develop in any part of the bone, from the surface to the center of the bone, called the bone marrow. A growing bone tumor, even a benign tumor, destroys healthy tissue and weakens bone, making it more vulnerable to fracture. When a tumor is cancerous, it is either a primary bone cancer or a secondary bone cancer. A primary bone cancer actually begins in the bone, while secondary bone cancer begins somewhere else in the body and then metastasizes or spreads to the bone. Secondary bone cancer is also called metastatic bone disease. So types of cancer that begin elsewhere and commonly spread to the bone include breast, lung, thyroid, renal, and prostate. So bone cancer actually comes from a malignant bone tumor. Bone tumors can either be benign or malignant. Both can actually be harmful to the body, both benign and malignant, but only the malignant bone tumor is actually considered as cancerous or called as cancerous. So for more in-depth discussion, here we have a video from Osmosis.
The bone cell divides uncontrollably and forms a mass or tumor. If the tumor remains confined and doesn't spread into surrounding tissues, then it's considered benign. But if the tumor invades into surrounding tissues, metastasizes, or spreads through blood or lymph, then it's considered malignant. Malignant tumors can either be primary, which is when they arise from bone cells, or secondary, which is when a tumor develops somewhere else in the body, metastasized, and spread to the bones. The most common sources of tumor cells that affect the bones that start somewhere else in the body are the breast, prostate, the lungs, the thyroid, and the kidneys. Now, even though bones vary in size and shape, they're all made of the same types of cells. And chief among them are osteoblasts, which build up new bone, and osteoclasts, which help with bone breakdown or resorption. Now, in addition to these, there are some more primitive cells in the bone marrow, called human mesenchymal stem cells, and neuroectodermal cells, which have the ability to differentiate into many cell types, including nerve, fat, bone, and cartilage cells. Now, in terms of anatomy, looking at a long bone, like the femur, it has two epiphyses, which are the ends that contribute to joints with other bones. Between the two epiphyses is the diaphysis, also called the bone shaft. In children and adolescents, there is an additional narrow portion between the epiphyses and the diaphysis called the metaphysis. The metaphysis contains the growth plate, the part of the bone that grows during childhood. In adults, the growth plate has ossified and fused with the diaphysis and the epiphysis. Now, there are genes that promote normal cell growth, called proto-oncogenes. With mutations, proto-oncogenes become oncogenes, and these overstimulate the cell growth. To balance out cell growth, there are other genes called tumor suppressor genes, which promote apoptosis or cell death of mutated cells. So oncogenes, or mutated tumor suppressor genes, allow cells to keep growing uncontrollably, resulting in tumors.
So that video was from Osmosis, and I hope it cleared things up with how the physiology of pathophysiology of bone cancer began. So here are primary here is primary bone cancer, and we're going to discuss the four most common types of primary bone cancer. So going back, primary bone cancer means that it's the kind of cancer that actually begins in the bone compared to secondary bone cancer, which begins somewhere else and spreads to the bone. So here are the four most common types, which is the multiple myeloma, osteosarcoma, Ewing sarcoma, and chondrosarcoma. Multiple myeloma. Multiple myeloma is the most common primary bone cancer. It is A malignant tumor of bone marrow, the soft tissue in the center of many bones that produces blood cells. Any bone can be affected by this cancer. Multiple myeloma affects approximately 7 people per 100,000 each year. According to National Cancer Institute, more than 130,000 people are living with the disease each year. Most cases are seen in patients between ages 50 and 70. Multiple myeloma is typically treated with chemotherapy, radiation therapy, and occasionally surgery. Osteosarcoma. Osteosarcoma is the second most common primary bone cancer. It occurs in 2 to 5 people per million each year, with most cases in teenagers and children. Most tumors develop around the knee in either the femur or tibia. Other common locations include the hip and shoulder. Osteosarcoma is typically treated with chemotherapy and surgery. Ewing sarcoma. So it actually occurs in patients between the ages of 5 and 20. The most common locations affected are the upper and lower leg, pelvis, upper arm, and ribs. Ewing sarcoma is typically treated with chemotherapy and either surgery or radiation therapy. So as you can see in the picture here, here is a healthy bone, and here is a bone with an Ewing sarcoma tumor. Chondrosarcoma. Chondrosarcoma is a malignant tumor composed of cartilage-producing cells. It is most often seen in patients between the ages of 40 and 70. Most cases occur around the hip, pelvis, or shoulder area. In most cases, surgery is the only treatment used for chondrosarcoma. So here we can see the picture of the bone with chondrosarcoma.
Among malignant tumors, the most common one is osteosarcoma. Osteosarcomas arise from osteoblasts of different sizes, called pleomorphic, and these cells produce too much osteoid tissue. Osteosarcomas often form in the metastasis, where there's a lot of cell division occurring. They most commonly affect adolescents. Some known mutations that are linked to osteosarcomas include mutations of the PRV protein, also seen in familial retinoblastoma, a childhood malignant tumor of the eye, and the p53 protein, which is also seen in Li-Fraumeni syndrome, a condition where there are a variety of cancers throughout the body. Another type of malignant bone tumor is Ewing sarcoma, which is also common in adolescents, typically between the age of 10 to 20 years. Ewing sarcoma is thought to arise from neuroectodermal cells, which look like small, round, blue cells on microscopy. Ewing sarcoma is associated with chromosomal mutations, specifically a translocation between the EWSR1 gene on chromosome 22 and the FLI1 gene on chromosome 11. You can remember this by 22 plus 11 equals 33, the jersey number of the former basketball player Patrick Ewing. The EWSR1 FLI1 fusion results in the expression of an abnormal protein called, you guessed it, the EWSR1 FLI1 fusion protein, or more simply, the Ewing sarcoma protein. This protein causes defects in the differentiation process of human mesenchymal stem cell and neuroectodermal cells, resulting in Ewing sarcoma tumor cells. Ewing sarcoma can affect a number of different bones, but most commonly affects the femur and the sacrum. Finally, there are chondrosarcomas, which tend to affect the elderly. Chondrosarcoma arises from the chondrocytes, which are cartilage-producing cells. Chondrosarcoma mainly affects bones of the pelvis, but can also affect long bones like the proximal femur and proximal humerus. On imaging, the mass is typically within the medullary cavity.
Okay, so that was an in-depth discussion about the types of primary bone cancers. Here are the signs and symptoms for bone cancer. Bone pain, swelling and tenderness near the affected area, fatigue, weakened bones leading to fractures and weight loss. For the diagnosis of bone cancer, there are radiologic studies such as X-rays, CT scans, bone scans, MRI, and bone biopsy. The risk factors for bone cancer are genetic disorders such as the Leaf-Romany syndrome, Rothman-Thompson syndrome, Paget disease, radiation, bone marrow transplantation, and injuries. Nursing diagnoses are ineffective protection related to abnormal blood profile as evidenced by bone marrow suppression, impaired oral mucous membrane related to chemotherapy as evidenced by mouth sores and inflammation, risk for injury related to brittle bones as evidenced by frequent bone fractures, anxiety related to change in health status as evidenced by expressed concern. Here we have the nursing management, which is assessing fluid and electrolyte balance, anorexia, nausea, vomiting, altered taste, mucositis, and diarrhea put patients at risk for nutritional and fluid electrolyte disturbances, modifying risks for infection and bleeding. Suppression of the bone marrow and immune system is expected and frequently serves as guide in determining appropriate chemotherapy dosage, but increases the risk of anemia, infection, and bleeding disorders. Next is administering chemotherapy. So the patient is observed closely during its administration because of the risks and consequences of extravasation, particularly of desiccant agent. Then, protecting caregivers. Nurses must be familiar with their institutional policies regarding personal protective equipment, handling and disposing chemotherapeutic agents, supplies, management of accidental spills or exposures. So, monitoring therapeutic and adverse effects. The nurse must be familiar with each agent given and its potential effects, and also the nurse must be aware of the impact of these side effects on the patient's quality of life. So promoting home and community-based care. The nurse teaches the patient and family how to administer BRMs or biologic response medication through subcutaneous injections, provides instructions about side effects, and helps the patient and family identify the strategies to manage many of the common side effects of BRM therapy. For medical management, there is amputation, chemotherapy, radiation therapy, biologic therapy, and hormone therapy. Prognosis for bone cancer. The prognosis or outlook. The overall 5-year survival rate for all bone cancers in adults and children is about 70%. Chondrosarcomas in adults have an overall 5-year survival rate of about 80%. The 5-year survival rate specifically for localized osteosarcomas is about 60 to 80%. If the cancer has spread beyond bone, the survival rate is about 15 to 30%. Ewing sarcoma have a 5-year survival rate of about 70% when they are found in a localized stage. If they spread outside the bone, the survival rate drops to 15 to 30%. Factors that are associated with a more favorable prognosis for Ewing sarcoma include smaller tumor size, age less than 10 years old, having the cancer in an arm or leg instead of the pelvis or chest wall, and having a good response to chemotherapy drugs. So that is all for bone cancer. Thank you very much for listening.